Welcome back here for Live Impact News on 13 News Now Plus. We are going to talk about a very important topic, with March being Endometriosis Awareness Month. Now, according to the World Health Organization, this medical condition, which can also affect fertility, impacts about every 1 in 10 women of reproductive age worldwide. Okay, it's a very important conversation we're having today. Joining us to talk more about it is Dr. Reena Talreja-Pelaez, an OBGYN who practices at Sentara, Virginia Beach General, and Princess Anne. Thank you so much for joining us today.
Thank you for having me. I'm excited to be here.
Okay, we got to start with the question of what is endometriosis, because I feel like with it impacting so many people, there's also a lot who don't know what it is.
Absolutely. That's a great start. Endometriosis is a common condition that we as gynecologists treat. It's a clinical condition where women experience symptoms related to the implants of endometrial tissue in places that it shouldn't be. There are cells that exist within the uterine cavity that can coexist outside of the uterus on other surfaces of the body, like surfaces of the outer uterus, the ovaries, and the tubes. And endometriosis can create some pretty debilitating symptoms for women. Typically, symptoms of endometriosis can be things like pain with menstruation when they have their period, pain with ovulation, pain during intercourse, and very importantly, it can lead to infertility as well.
So what are the signs and symptoms for those who might be experiencing endometriosis?
Yeah. The most common symptoms are going to be related to pain. So for women who have endometriosis and experience symptoms, because there are a subset of women who don't have any symptoms, but for those who do, what they might notice is severe and debilitating pain during their period, and particularly in the days preceding their period and lasting beyond their period. They can also have pain in the midpoint of their cycle during ovulation. They can have pain when they're intimate with their partner. Sometimes patients can have difficulty conceiving, and in rare cases can even have pain with urination or defecation, but that's a little bit less common.
You know, we were talking before this. I know I have close friends who are very much so impacted by endometriosis, and theirs is pain. Like they speak about the pain, but you just mentioned that there might be people who may not feel that pain. So how would I know, or how would a woman know that they're experiencing that if that pain is not associated with it?
So typically, for those women who have endometriosis, but they're asymptomatic, meaning they experience no symptoms, it's something that we pick up when we're doing surgery for other reasons, and we're actually inside the abdominal cavity looking down into their pelvis. Endometriosis is a really interesting disease process because the extent of disease we see doesn't always correlate with the symptoms. I have many patients who have very small amounts of endometriosis when I operate on them, but are severely debilitated and miss work days and miss activities because of their pain. And on the opposite side, we have some patients who will do surgery and will find very extensive disease, and they were unaware. They had no symptoms at all. So it's a unique condition. But for women that are symptomatic, which are those we focus on, the key is eliminating symptoms and preserving fertility, particularly if they haven't yet had the opportunity to have their family.
So at what point should a woman go to the doctor and say, I need to be treated, or I need this to be looked at?
Yeah. You know, most women experience some discomfort with their period. For a typical person who has what we call dysmenorrhea, which means normal amount of menstrual pain, they'll say, I start having pain the day my period starts, or maybe that first day or second day. I don't usually have to miss work. I take an Advil and I'm fine, right? For patients who don't fall in that category and say, my pain starts 3 or 4 days prior, I miss 2 days of work, I'm taking Tylenol, I'm taking ibuprofen, I'm using a heating pad, and none of it's helping me. Those are women who really need to present and be evaluated. Typically that evaluation will include a history, an examination, often ultrasound as well to look for signs of endometriosis, which we can sometimes see, and may even involve surgical exploration. But that initial step to talk to their gynecologist is really important, again, to help them feel better and have a better quality of life, but also to help preserve their fertility in the future.
In terms of a cure, how is this? You've already kind of talked about it a little bit, but specifically, Is there a cure? How is it treated?
Good question. There is no cure per se for endometriosis, but it is a condition that one should consider as a lifelong condition with a waxing and waning time course. Typically, once we get people in therapy, we can control their symptoms, and there's a variety of treatments. Some treatments are aimed towards alleviating pain, right? We use non-steroidal anti-inflammatories, heat, other types of pain relievers. We use hormonal therapies to affect the progress of the disease. Sometimes that includes things like birth control pills, patches and rings, progesterone agents. And then there are a lot of wonderful new medications that are developed specifically to suppress endometriosis and prevent its progression that work on a pathway called the GnRH pathway, and they're both oral and injectable medications. And then for some women who need further evaluation or are not responding to those therapies, we do surgery to treat endometriosis, and that's a lot of what I focus on in my practice.
And Sarah, I know you had a question in regards to the diagnosis process of endo.
Yes. Sorry, let me get the mic. I had a couple questions. One would be, what is normal pain and what is not normal pain? Because I feel like women oftentimes, they have a high pain tolerance, or they think that something's normal and it's not. And then I know that sometimes it can take a long time to get diagnosed with endometriosis. So what is the diagnosis process like?
Yeah. You're 100% correct. The average time from a person's onset of symptoms to the diagnosis of endometriosis can be upwards of 7 to 9 years.
Oh my.
And I think that's due to a couple factors. Some of that is awareness, right? Women may just suffer with their symptoms before seeking care. They may initially talk to providers who maybe aren't well versed in endometriosis, or perhaps don't take their complaints seriously. And finding the specialist who's going to be able to help you make that diagnosis can take time. So I think awareness is, and things like Endometriosis Awareness Month, very important so people understand. The diagnosis process usually involves history, examination, and ultrasound to start with when patients come in complaining of pain or infertility. Sometimes there are signs we can see there that make the diagnosis very clear. Other times we'll start a woman down a path of a particular pain control approach, and if they fail that, they may end up needing surgery to evaluate for endometriosis. So I would say it is definitely a relationship. The key is to find a provider who understands endometriosis, usually a gynecologist, and then work through attempts at controlling pain. If they're unsuccessful, moving to the next step in the evaluation until we can kind of get things under control.
And I have a follow-up question to that based upon just personal experience from some of my close friends I was telling you who are still, experiencing endometriosis at various levels. The advocacy portion of this, how would you advise that women bring this up, particularly if they are experiencing maybe a doctor who you said may not be as well versed, or they're having trouble getting them to understand the pain that they are in? Because I know for at least 2 of my friends, that was a challenge for them to get the doctor that they were seeing to understand how serious it really was for them in terms of the pain that they were feeling.
Great question. I think there's 2 thoughts here. One is quantification and of pain is very helpful to your provider. So if patients are having pain, it's very helpful for patients to keep a log of their pain and help quantify the amount of pain using a scale of pain on 1 to 10, identifying activities that had to be eliminated because of the pain, understanding how many missed days of work a patient has experienced, understanding what activities they were unable to do because of their pain, helping quantify for us what steps have been taken to alleviate pain, what medications have been tried and failed. It's very helpful. And using that in a monthly kind of a calendar sort of format is very useful. I think the other thought is to find the right provider, right? I would definitely seek care from a gynecologist if your primary care provider isn't comfortable evaluating this. And once you see a gynecologist, find a gynecologist who treats endometriosis on a regular basis and understands the process, because not all of us have the same training, not all of us have the same areas of interest or expertise.
Okay. Sarah, did you have another question?
I think that answered it.
Yeah.
And we talked about pain a little bit, what's normal, what's not normal, and then the diagnosis. So I think you answered all my questions.
Yeah. I would ask this, we talked about how even though this impacts so many women, there are a lot of people who don't know about endometriosis, which is why you come in on this platform and months like this, awareness months, are so important. Are there any misconceptions that you often hear that those who have heard about it may have about endometriosis that you would like to dispel?
Yeah, I think a lot of women who get the diagnosis of endometriosis are fearful. They are worried that they will not be able to live a normal reproductive and sexual life, and that's false. Most women with endometriosis are very able to control their symptoms over their reproductive life with the use of medical and surgical interventions. I think also another myth for women who are diagnosed with endometriosis is that I'm going to have surgery and it's going to be better and I'll never have to deal with this again. And that really isn't the case. Even for women who choose surgery to treat endometriosis, most of them will need some sort of ongoing medical therapy to suppress endometriosis in order to, live their life to the fullest, limit symptoms, preserve fertility, and be able to have the family that they're hoping to have when they're hoping to have it.
Thank you so much for breaking that down. Is there anything else on this very important topic that you feel like our viewers or whoever's going to be listening and seeing this should know when it comes to endometriosis?
Well, I think the evaluation for endometriosis and the treatment of endometriosis, it really falls within a spectrum of a lifelong relationship with your care provider, right? Most women should, during the course of their reproductive lives, be seeing a gynecologist yearly. And I think that would help with the delay in diagnosis of endometriosis. Women should be coming in to see their care provider for regular cervical cancer screenings, breast exams, mammograms, all of these things. And for those patients who have that regular relationship with an OBGYN, it is easier for us to identify when the symptoms they're experiencing are not normal and may represent disease process that needs to be managed. And so I would encourage women to maintain that relationship and invest in that relationship on a yearly basis in hopes of avoiding complications and problems related to endometriosis and other gynecologic abnormalities over the course of their reproductive lives.
Okay, thank you so much. This again, Dr. Reena Talreja-Pelaez, OBGYN, based out of Virginia Beach. Great information today, and I hope that there are people who are listening and watching. Not only will they take heed to what you have advised today, but they're a little bit more educated as well on the condition of endometriosis. So thank you so much for this.
Thank you for having me.
Absolutely.